perverting the natural market, and the rest, as they say, is history. If you examine healthcare-related expenditures in this country, you'll find that ground zero for the explosion in healthcare costs occurred with the implementation of Medicare, Medicaid, and then HMO legislation, because this took payment for the service out of the hands of the patient and put it in a third party, whether that's a government or an insurance company. It also took treatment decisions out of the hands of the doctor and put it in the hands of bean counters. Doctors must now get permission to treat you, and if they don't treat you the way that the government or a healthcare insurance company mandates, they don't get paid. In one fell swoop, you and your physician were taken out of were removed from your healthcare equation. To put this into perspective, wives in the audience, would you ever give your husbands $200 and without a very detailed list, send them to the grocery store to do the shopping for the week? Husbands in the audience, would you give that same amount of money to your wife and ask her to go to Bass Pro Shops to buy your fishing gear for you without a very detailed list? And these are analogies about groceries and fishing tackle. What we're talking about here is the United States healthcare system and your freedom and liberty as Americans. My friends, this is a recipe for disaster, and there's only one true solution to avert this disaster, and that is to put the patient and the doctor back in charge. Another element contributing to the explosive rise in healthcare costs that cannot be overestimated is malpractice litigation. That drives up the cost really on two primary fronts. The frivolous lawsuits that affect a doctor on a one-on-one basis, because then they have to recoup that money that they spend on malpractice insurance, which can be up to $100,000 a year per physician. But the larger cost is actually much more insidious. In order to avoid potential litigation, physicians must order multiple costly tests to confirm, reconfirm, and then reconfirm the reconfirmation, so that they will have documentation ad infinitum in the event that something does go wrong. Now, this causes massive healthcare cost increases across the entire healthcare system. Without significant healthcare reform, there is no significant healthcare reform. More reform. Now, just for a moment, however, let's briefly look at what is being proposed in Washington to, quote, fix healthcare. $1.6 trillion. And that's just the first estimate to cover only one-third of those said to be uninsured. We must spend over $1 trillion to save money. Now, only in Washington could a statement like that be made with a straight face. And have you ever known of a government program that actually came in on budget? President Reagan once said that government is an alimentary canal with an insatiable appetite on one end and no sense of responsibility on the other. And never has that been a more accurate description. But just for a second, let's run with that $1 trillion number. It's hard to even fathom how much money that is, so let's think about it in a little slightly different terms. What if $1 equaled 1 second? How long ago was 1 trillion seconds? Well, it was approximately 31,709 years ago. When I first did that calculation, I had to triple check it because it seemed so ridiculous, but that is absolutely accurate. 31,709 years ago. Knowing the numbers and how we arrived at this crossroads, that's useful information to have, but we cannot allow ourselves to get into a semantic argument with liberals over the numbers. We must oppose their entire concept of socializing healthcare at the fundamental ideological level. And to that end, we need to establish one fact at the outset.